is a medical virtual assistant and what do they really do? In today's video, I'm going to be giving you all the information you need to know about a medical virtual assistant. So let's delve right in. Hi everyone, my name is Precious Isochi and I'm a registered nurse who is currently transitioning into the medical virtual assistant role. And so, who is actually a medical virtual assistant? A medical virtual assistant is a trained remote professional who supports healthcare providers with both administrative and clinical support tasks. Now, these tasks help healthcare providers focus more on patient care while the workflow behind the scenes run smoothly. Now, what does a typical workflow looks like for a medical virtual assistant? One of the primary tools a medical virtual assistant uses to work with is what we call the electronic health record system, which is known as the EHR. This is where patients' information, appointments, clinical documentations are being managed from. A typical workflow for a MedVA would be first trying to review providers' schedule for the day, preparing patient charts ahead of the patient's appointment, right? Now, another important responsibility for a MedVA is appointment scheduling and calendar management, like booking a patient's appointment, right? Confirming patient visits and adjusting the calendar when necessary. Medical documentation is a key part of the role. A lot of providers are so busy, they just want to see the patients because there are so many patients to see in a day, right? So as a result of this, the MedVA comes in after the provider must have seen the patient, ensuring that clinical routes are well organized, like SOAP notes, the DAP notes, and making sure that every information is accurately documented without any mistake whatsoever in the patient's record. Medical virtual assistants can also assist with insurance verification. Now, in the US, a lot of patients use insurance. So what the medical VA does is that he or she will definitely confirm this patient's benefits before she visits the provider. In most cases, medical virtual assistants also help with prior authorizations. This involves communicating with insurance company to obtain approval for certain medications or for certain procedures to be done for the patient. For me, a medical virtual assistant is like a middleman between the healthcare provider and the patient. When the healthcare provider is unavailable, a medical virtual assistant steps in to answer patient questions so they can be seen and heard. And at the end of the day, you have a happy patient and a happy healthcare provider. And of course, a medical virtual assistant who knows how to do her job. So that said, in my next video, we are going to be talking about the do's and the don'ts of a medical virtual assistant. Thank you for watching. Please like, share, and comment. And see you on my next one. Bye.